Good morning, everyone, or afternoon, or depending on where you are. I am Ashley White, AOPA's Director of Health Policy and Strategic Alliances, and we will get started with this webinar in just about 2 minutes. It looks like some folks are still joining, so I will hold off jumping in early, but wanted to say hello and let you know we're getting started soon. All right, I am showing noon on the dot, so I'm going to go ahead and get us started. A few housekeeping items. You should see a panel, a GoToWebinar panel. It should be on the right-hand side of your computer screen. That is where you'll see all of the functionality. If you need to let me know that you'd like to ask a question, if you want to ask that question verbally, I can unmute your line and allow you to just ask the question. There's also a questions panel. You can pop your question in and it'll flag it for me, and I'll stop and answer the question. I prefer if you ask questions throughout the presentation, because most of the time your question will likely be about the part of the co-op of the compendium that we are working in. So as we go through the tutorial, it would be great if I know that you have a question about a specific topic area, then I can go ahead and address it while we're still in that part of the co-op. A little bit background on me. I've been working here at AOPA for 5 years, and prior to joining the team here at AOPA, I ran a 5-facility patient care group in North Carolina called Beacon Prosthetics and Orthotics. That company was founded by my father, who is a prosthetist and has been a prosthetist all my life, and so I am very rooted in this profession and care deeply about your practice and know what it's like to need information and to have it at your fingertips. And so when I joined the team here at AOPA, my first assignment was to build out a compendium of the information that AOPA had that would help you all in your practice. And the way I looked at that assignment was that this would be something that I wish I would have had as the director of operations at an O&P facility. So if I had had this resource when I was in practice, when I was at Beacon, it would have helped me run things so much more smoothly. So that's the way I envisioned building it out, and here we are. We launched this in 2017. I know some people are just finding out about it, but it is a great resource, and this will be our last full co-op tutorial for a little while. We've been doing them monthly, but I've taken a new position here at the organization, and so we're going to we won't be having them every month moving forward. So we'll still have some tutorials, and we'll certainly be able to set up tutorials for your companies if you want to get your staff trained, maybe during a lunch and learn or something like that. We can absolutely work with you all to set those up. I see a question in already, so I will go ahead. Yes, so the question is about, will this be recorded? The answer is yes, this is being recorded, and it will be available through the link that you received when you were registered. So you'll be able to watch this for 2 weeks after. It'll be available for 2 weeks after. You can share it with your teams, your staff, and anyone else that that might need it, that you want to share it with, on your teams. So before I share my screen, just one more quick thought. If you haven't already signed up for the co-op, if it's not something that your team has access to, all you need to do right now is shoot me an email at awhite@aopanet.org. That is the best way. It's the easiest way to make sure that your company is signed up appropriately and that we make sure we get people the access that they need. I'm going to share a couple of ways that if you're already signed up for the co-op, the way you can get to the co-op here just in a minute. So if there aren't any general questions, I'm going to go ahead and share my screen and launch the tutorial. I appreciate you all joining us today. All right, so I'm hoping everyone sees my screen. If you do not, please pop a note in the chat to let me know. If you're not able to see my screen, it looks like this is what you're seeing here on the screen is the same thing I'm seeing. So this is just aopanet.org. This is our website, our homepage. There's a few ways that you can access the co-op, and I just wanted to share those with you really briefly. So if you're a member, you can go here and sign in here, and it's going to take you to a page that looks like, nope, not that, this. You'll land, it'll be your account, you've logged in. You'll see over here on the right-hand side, it should say My Co-op here. If you click this link, it will automatically log you in to the co-op. If you've already signed up and you're already logged in once, it should automatically log you in. You shouldn't have to put your password in again. But you do have to create that password in the beginning, and as you all should know, the co-op licenses, the co-op is built on a platform called Atlassian Confluence. It is a really robust content management, knowledge management platform. It's built just like Wikipedia. So when we go through, you'll kind of see what I'm talking about the Wikipedia thing. But it's a really robust software system, and that is a separate system from our database, which is what our association management is in. But we did create a way for you to be able to have a smooth transition, and that is going to be over here in your account links. So you'll see My Co-op there. So that's a great way for you to always be able to access your co-op, and anyone in your company can share that login. So each company gets a license per registered location with AOPA, and you should be able to share those licenses. Everybody can log in on the same time. There's not a problem with that. So that's just a little background. If you're not already set up on the co-op, I'm happy to help you get set up. All right, so let's jump right in. Let me close these windows out. So I'm going to make this as big as I can make it, and you guys will see here. So I'm logged into the student account. This is going to be the one that looks most like yours. With one caveat, right now I have the compliance handbook activated in the student's account. The compliance handbook is an add-on feature. If you purchase a compliance handbook from AOPA, it's part of our bookstore offering, then you automatically will start to see this little block in your homepage. It's the compliance handbook is built out from it's an interactive version of what you would receive when you purchase one. So you get an electronic file of the compliance handbook when you purchase one, and then I get a note to say, hey, turn on the compliance handbook in their co-op, and I go in and I can turn this on. So it's self-contained. I'm just sharing you a little bit. Do a little sales pitch here. But you'll see you can bring, we have all the sections bringing your company into compliance, the development of standards. We've got sample versions of all those files for your compliance guides, and the development of policies and procedures. You'll see we have assignment, billing, prior authorizations, all the compliance components of that for your compliance handbook for your company. So those are all the areas that are covered by that. So that is the one difference. You won't see that in your account currently, but you can always purchase a compliance handbook, and then we'll turn it on as a feature in your co-op for you. The co-op that you do have access to as a free AOPA member benefit is going to be this one right here. So you'll click on that space, and this is what we call the AOPA co-op. This is the landing page for the AOPA Co-op. I'm going to back out for one quick second to share some nice features that are on your home page. So this up here will always stay. This up here will always stay here. This is going to be the top line navigation. And you'll see here you've got any pages that you've recently visited, anything that you're working on. If you made an edit or made a comment on a page, it'll show up on worked on. So there was a comment made on the sequestration page by the students, and so that's showing up there as worked on. And then you can have some starred pages. So the students have some starred pages in their account here. And here over on the right hand side, you see feed. These are all the most recent updates. So Joe McTurnan answered a question yesterday from Michelle Harper's question yesterday on the co-op, and you'll see that I've updated some pages recently, updated the VA OMP page, the VA DOD page, the AFO policy page, and the Medicaid page. So all these were updated yesterday. And you'll see we've got comments from other AOPA members. So this right-hand side, the feed on the right-hand side, is a great way to just follow along with what's going on. But I'll show you how you can follow those specific pages if you want to keep your updates limited and you want to know just what's going on certain pages. I'll show you how to do that as well. So again, ask your questions as we go through the tutorial and let me know. Any feedback also is welcome and appreciated. So I'm going to go into the co-op again, and this landing page is just going to be some initial updates. Once we know when the next tutorial will be, we're hoping, I'm hiring 2 new people underneath in my department. So we will likely start up those monthly tutorials again in the coming months, and we'll be updating here so you can let your team know. But we also share just some general background about the co-op and why we named it the co-op. So you know, the word co-op means a cooperative society, business, or enterprise. And we believe that we're better together, and knowing that we have the information about what's happening on the ground in patient care facilities is really important. And as policies start to change, even at the state level, it's really important for us to hear that from you all so that we can build the most robust compendium of information possible. So it is a mutually beneficial arrangement, because without knowing what kind of claims denials you all are seeing, AOPA can't know that we need to take some action because there's some you know, misinformation at one of the insurance companies or something like that. So we really do think that this is like Wikipedia in that way. And you'll see when we go through the content of the pages that it actually looks like Wikipedia in some cases. So the most important content areas are over here on the left, but they all break down into pretty significant areas of topic areas and areas of information. So you see this is Medicare, but Medicare has all these other categories under it. And if you just even go into audits, it has a separate page for all the different types of audits. And we'll start to go through that content a little bit more. I'm gonna make everything a little bit bigger on the screen here so you can all see it a little better. Quick nav, you'll see some quick navigation along the way. These are, again, these main topic areas. These are the same as over here, but that'll look different on different pages depending on the content that you're looking at. So if I go to Medicare, you'll see this alert here at the top of the page. And this is a pretty recent alert. And this is the type of thing that you're going to see pushed out to the top of every page. But say we didn't have an alert to push out to you. You'd land on the Medicare page and it would look something like this. Now, this is just a description of the Medicare program and how orthotics and prosthetics benefit fits into that Medicare program. So like Wikipedia, it's explaining, it's very, informational in the way that it's explaining what the Medicare program is and how OMP functions. It even talks about the different congressional offices that oversee the maintenance and the benefit itself in the Congress. Over on the right, that's that quick nav I was talking about. These are those areas. Again, these areas are duplicated over here on the left. So you're going to find some pretty regular announcements that are posted at the top of the Medicare page. if you do a lot of business, a lot of Medicare business, you're submitting a lot of Medicare claims, it might be really important for you to watch this page. And by watch, I mean this eyeball here. It means that you will receive an update email every time we make an update to this page. Now, if you feel like you're getting too many updates, it's just too much and you don't want to receive all of those updates, you can always stop watching this page, or you can stop watching. You may be watching all the content in the entire space, which means you're getting an update every time we make an update to the co-op. You're getting an email about it. Some folks have found that that's too many emails and they don't want all those, so they have unchecked the watch all content box and they're just watching individual pages that they're most interested in. Now, this might matter more if you have, say, a billing person that is overseeing your co-op account. So you've got someone that's going to watch for any kind of updates to claim submission or coding or billing information, but maybe not necessarily will be interested in things that might be updated in other areas like the VA. So you do have some flexibility in the way that you manage those pages. Now, you don't have to go to every single page to check the box or uncheck the box in that case. You can go to your profile here and to settings. So up here on the right, there's a little icon there. You can go to your settings. And in these settings, you can look at watches. So when I said you're watching a page, you can go to your watches, you can see the pages that you're watching, and you can stop watching whichever pages you're getting too many emails for. So what I've actually found most people doing is watching the entire thing, and if they feel like they're getting updates about content that's not relevant to them, they come into this area and then they'll stop watching that specific page, because that way they know they're going to get more updates than they need and it's not relevant content for them. So popping back out over to the Medicare page, we're going to start to dig into the content so you can start to see what kind of information we're sharing here. I'm going into the audits page. It's actually an update on the audits page about post-payment reviews for replacement sockets. This was issued by jurisdictions B and C. So this announcement came as soon as we heard about the announcement. We made this post back on June 15th. So again, it's a great way for you to get the most relevant information about a certain topic specific to your business, but also it's all self-contained on this page about audits. So if you need your staff to stay on top of all that information and you want to make sure that they have it and they can actually reference it and it's related to whatever other policies exist, this is the way to do that. The co-op is the way you're going to find that information. So we do cover RAC, certs, prepayment, and ZPICs. We also occasionally you'll see an Almanac article, and if you take the quiz that's linked in this Almanac article, you'll get two continuing education credits. So it's a great way also to just educate yourself, learn a little bit more about audits, and get those continuing education credits if you need them. Now, on this main audits page, one of the reasons that a lot of AOPA members use the co-op as a training tool is because we dig down into the basic levels of information. So if you imagine our coding and billing seminar, which Joe and Devin lead for AOPA, it's a crash course. It's an intensive crash course in how to submit claims and work with Medicare and other payers. This is what we would call the textbook for that course. It has all of this, the whole universe of information that Joe or Devin or any of the consultants that work those seminars would be presenting on at any given time. But this is the place that you can always reference back to. So if you've ever been to a coding and billing seminar and you get one of those big thick manuals, there's nothing in that manual that you cannot find on this co-op. So different types of reviews. It talks about the different types of reviews and why and what you can expect. We also create notes here. So we had a question that came in during one of the tutorials, and they said, well, how many RAC audits can happen at once? And so I went back and looked it up, and that's a great thing to put on the co-op. RAC audits for O&P are limited to 10 audits per tax ID per 45 days. So you'll see a lot of those kinds of references throughout the co-op. So say I'm actually, I just don't have time to go through this kind of navigation and figure out what I'm looking for. Imagine I just want, let me back all the way out so I can give you a real assessment of this. So imagine I just want to look up RAC audits. We've got a RAC audit and I need to know more information about RAC audits. So I just type in RAC and it takes me right, you'll see. So we've got some RAC audit information in our good practice section. We also have it in our code of interactions, but you'll see that's a page dedicated entirely to the RAC right there. And this was the audits page that we were just on. So the search feature is really robust. It's a great way to just jump in and get the information that you need. Again, that search feature is over in the right-hand side, underneath the little magnifying glass is where you'll find that search feature. So I'm going to pop into that RAC page, and then you'll see here that the RAC contractors had suspended additional documentation requests during COVID-19. So that's the most recent update that we have there. But you'll see the recovery audit contractors. This is just generic information about RAC. So you'll know what is RAC. Your company will know, what is a RAC audit. As we start to hear more about the uptick in RAC audits again, you'll see alerts about RAC audits that are going to be posted here. I'm popping back out to audits. Some of you have experienced the Target, Probe, and Educate audit strategy. This was launched in 2017, but has pretty much rolled out fairly well over the past few months. So we keep updates with the quarterly reports there and information about that. So this is the most recent type of audit that's been introduced in the auditing process for Medicare. Moving on to the claim submission section. Again, this is such comprehensive information. It's just really like we just dig down into everything. We could spend a whole day just on this section actually. But instead of going through every single one of these, I'm going to show you some of the tools that we have added to the co-op that we didn't necessarily build, but we have linked to and in relevant places. So we get a lot of questions about inpatient billing. This is, definitely the type of question that you'll see on the listserv a lot, the type of question that might come through one of your offices if someone's pushing back at a skilled nursing facility as an example on the way that you're trying to bill them for an item you're providing. There's no reason that you should ever have to worry about whether you're doing it right or not. You've got the information and you've got the law, the rules that govern the reasons that you have to do the things that you do, the way that you have to process claims when billing for inpatient items. So we've covered hospital, skilled nursing facility, and the PPS exclusion list is noted here. And on the skilled nursing facility page, we've actually even added a tool that was created by CGS that allows you to search the consolidated billing process and get an answer directly from CGS. So I'm going to go ahead and take you over to this tool. We've linked it here. I wish we would have created it, but we didn't. I do accept, thank you. So you'll see you put your code in here, and then you'll search consolidated billing, and then it will give you the answer that you need. Again, these are the details it provides. It provides how to bill for that Part A stay, and if the item is payable in a SNF once that Part A stay has ended. So it will give you all of that information if you just pop in your code there and go through the process, the queue process. So going back to the co-op. So that's a neat tool that we've provided, but we did also provide the old way of figuring it out, which is this diagram here. And if you've seen a coding and billing manual, this is in that manual as well. And again, we always reference where we're getting this information. So this came right out of the Program Integrity Manual, Chapter 4, Section 4.261. So you can look it up yourself directly where it came from. Now, anytime we have a source like that, we're going to cite it throughout the co-op. We're going to cite those sources because you don't have to say, well, AOPA said. You can say, well, the Program Integrity Manual says this is the way that I have to do it. So we want to make sure we're providing you with as many resources to reference as possible as well. And backing back out to that inpatient billing section again, really quickly, I'm going to pop into hospital and just show you that we also share an inpatient billing hospital diagram for additional information. So again, the claim submission section is robust. A couple of other areas I'll highlight are the modifiers page. We get a lot of questions about modifiers, and CGS has developed a really cool tool for modifiers. So wish we did it, but they did it, and so that's great. We're going to share it with you. This is their modifier tool, so you could select your category, you'd select your code, you know, whatever that code might be. You select a scenario here, and then it will provide you with information about which modifiers you should use. This is a really cool tool, and you won't be getting it wrong because you're hearing it directly from the contract, the DME MAC contractors. And again, there's a reference to one of those Almanac articles where there's a quiz there, and you can get 2 free CE credits. And then we have the old school list here. This is just a way to figure out when do you use a certain modifier when you're submitting a claim. All right, moving right along. I don't see any questions, but please don't hesitate to ask them. If you want to ask a question verbally, please just raise your hand. You can use the hand icon. It will flash and let me know that you've got a question. But I'm going to keep moving right along. We do talk about corrected claims, denials, remittance notices, and the appeals process. I'm going to pop into the appeals process for a second here and just share. We provide some tips and tricks on the appeals process, but we also kind of do a deep dive on each of these levels. And you'll see that there's a process associated with each of these levels, even down to the judicial review process. All right. So, and we do provide information about how claims processing works. This is, again, like one of those Wikipedia pages where you just get to look and see this is how the DME MAC processes those claims. It's great for training and just for your office's knowledge. We get this question a lot about refused and returned items and how to bill for those and what can you do when something is refused or returned. There's a policy for it, and it's just important to know that if you had this question and you weren't really sure where to look or weren't really sure where to find that information, you could easily pop refused or return device or something like that into the search feature, and it would populate this policy for you. So again, always use that search feature if you're not really sure where to look for something in terms of the navigation on the left-hand side. Moving along to coding, we've got a coding update here. We've got some more corrected coding reminders for scoliosis bracing. This is fairly new. Mid-year last year, I think, is when we learned about it, and we've been pushing out information since. But if we didn't have those announcements, again, it would be like a Wikipedia page where it just talks to you about the HCPCS coding system. We have the principles, we've got the history of the L code system here, kind of deep dive down into how it became what it is in 1979. So it's good historical reference, and especially when you've likely heard the complaint in the past, this L code system is so broken. We do not disagree with you, but it is the system that we have, and we are here to make sure that you can operate as best as possible in that system. So this is just a good background information on L codes and claim submission in general, the coding process, I mean. And then under here, we've got some pretty good detailed information. So if you've ever purchased a quick coder from AOPA, that is that laminated quick coder. It's usually somewhere back in your lab, and there's usually plaster on it. We recreated that in the co-op, and since there's an app, technically you can have the quick coder in your pocket. So that laminated version is not going to fit in your pocket, or it shouldn't, because you've really damaged it if it does. But your phone, if you open the app for the co-op on your phone, you should have this right at the tip of your fingers. So say you're looking up the codes and the descriptors for spinal orthosis, it's going to be right there. You can just open up your phone, open up your Confluence app, and this will pop up. We also created a pretty robust L-code search feature. The cool thing about the L-code search feature here is that we're starting to link directly to these product pages. So we have a Supplier Plus program. AOPA is a membership organization for patient care facilities and manufacturers. And so the supplier manufacturers have a mechanism that allows them to add their direct links. So when we talk about keeping things self-contained, this is so you don't have to Google and you don't find some random not official page about something that you need information on. In this case, we'll say lower extremity orthoses is an example that we'll use. We've got all of the PDAC verified L codes and A codes over here on the right-hand side, and then we've got the products that are related to those specifically. So let me back out a little bit so you guys can see. You can organize this by manufacturer or by product name or by L code. It gives you a bunch of different ways to do that. But if you go by manufacturer, you'll see that Allard has listed some of theirs. They've already linked these in their detail section. If we wanted to go to that product page, Allard has provided the link that they would like you to land on. This is where you're going to find the most information out about that product, and it's directly associated with its code. So it's a good way to make sure that if it's PDAC verified, you can check on the co-op and it'll take you to Allard's website instead of having to Google. I mean, Google's fine. There's nothing wrong with Google. It's just that we wanted it to be easier. We wanted to put it all in one place for you, and that's what we've done here. And it's the same for all of the areas. We've done spinal, we've done all of the PDAC approved areas and L codes. Just like there used to be a site called lcodesearch.com. That site's pretty dated, so we recreated it in a little bit easier format here for you all to use. There is a correct coding initiative. This is something that you might hear someone say. A correct coding bulletin has been published. This is information where you can find out about that, and you can find out some of those. If you hear AOPA folks using a lot of acronyms related to coding, this page has some information about what those acronyms actually mean. So we apologize if we say something, like MUEs. I mean, that's a commonly used term. Here's a way for you to share with your staff what that means if you wanted to educate, staff on what all that terminology is. And speaking of terminology, we actually have a glossary of terms built out for Medicare. We have a separate glossary of terms built out for the VA and DOD because they use different terminology. And where private payers have published their own glossaries of terms or terminology sections, we've recreated those on the co-op as well. So I think Aetna has its own glossary of terms, and those are different than the terms that Medicare uses, but it's important to know, what are they referring to when they say this? And a good example of that is Medicare uses the term prior authorization, but in a lot of cases, private insurance companies will use something like pre-certification or pre-authorization or or prior certification or something like that. So because the terminology is different, it's important to know it's really all the same, and lots of terms can be interchangeable in that way. Glossaries are important, especially if you've got someone that's just joined your team from a different area of healthcare, and they may think, yeah, I came from a doctor's office or something. Well, OEP is a lot different than physicians' offices. It's a much different environment in terms of healthcare. So it's important that you help train your staff and that they're aware of these terms. One of the most utilized areas on the co-op, and this is at month over month, 70 people have viewed it, well, in the past, and that's a 30-day retrospect. So 70 people in the past 30 days have gone to this page to pull up a specific policy, and each of these have a different amount. So 74 people have actually pulled this direct policy up over the past 30 days. So you'll see here, this is the AFO LCD, local coverage determination, Medicare's coverage policy. And we've got an update here at the top, but if you scroll down, it'll start to show, it explains how that AFO policy works, and then we've broken it down into sections. So we've got the definitions, and we've got what coverage, when a claim will be paid for AFOs that are not used during ambulation. So that's going to be different than AFOs that are provided for patients during ambulation. And that all is broken down. You've got the policy related coding there. You'll see really just digs down into all of the detail that you need to know. And then we link the policy article and the LCD here. So these are live links that'll take you over to CMS's website. I'll just show you to show you how that works. Anything with the little arrow off is going to take you out of the co-op, so you'll have to use the back button to get back in. But this is the local coverage article, and this explains sort of any information that you need to know about claims processing for the coverage of AFOs and KFOs. And there are LCDs for all of these areas: external breast prostheses, knee orthoses, lower limb, orthopedic footwear, spinal orthoses, therapeutic shoes and inserts, and then there's the section on LCD part and policy article differences. So these are the only local coverage determinations, but all 4 of the coverage areas operate the same way. So we have no national coverage determinations in orthotics and prosthetics, but the local coverage determinations act like national coverage determinations because they are accepted by all of the jurisdictions. At least at present, we haven't seen any big discrepancies between those districts. We have a Medicare as a secondary payer section here, and we also have a managed Medicare section. These are sections that we are building out pretty regularly these days, just because we're finding out more and more information about the Medicare Advantage plans, what your patient's rights are as Medicare beneficiary, and if they have a Medicare Advantage plan, and some of the challenges that we're seeing with those Medicare Advantage plans. So these are all spelled out here for you and for you to use and share with your patients. We created some pages for prior authorization recently, now that we have prior authorization in prosthetics, and we've also created a new page for the competitive bidding program. I'm sure you all are aware that there are 23 codes that are competitively bid now, these off-the-shelf orthoses. You can always reach out to Joe McTurnan or Devin Bernard if you have questions about the competitive bidding process, but we did create these pages for you all to use and reference. So that's a quick overview of the Medicare section. Again, I could probably do a whole tutorial on just one section of the section, but it's a robust platform, and it's a great way for us to just share all of the information that we have at AOPA and put it right at your fingertips. I'm going to go through the rest of the sections fairly quickly, but I do want to pause for a second and just make sure there aren't any questions since I'm moving away from the Medicare section. Is there anything that you'd like to see me share, or do you have questions about sections that maybe I didn't cover but you want to know if they're on here? Anything like that, don't hesitate to pop into the question panel or raise your hand and I'll unmute you. We cover Medicaid in a couple places on the co-op, but this Medicaid page here, you can think of as like, what is the national policy for Medicaid? So CMS actually stands for the Centers for Medicare and Medicaid Services, and Medicaid is a division under CMS. And so this Medicaid page, you can think of as the federally run Medicaid page. But a lot of what happens in the Medicaid program is very specific to your state. So what we've said here, and I've highlighted, is that if you're concerned about something that's happening in Medicaid in your state, it's really best for you to go to your state page, because that's where you're going to have a lot of that robust information and commenting from different folks in the states about what they're seeing. And if there are new policies that have been pushed out from Medicaid, those will also be there. As we receive those from you all as members, we post those to the state pages. So State Matters section is a section that I'll get down to. in a little bit, but again, this is what, if say something changes in the Medicaid program and Medicaid says that, they no longer have to cover things for children, devices, prosthetics and orthotic services for children, then we would post that as a big announcement here. But for state-specific Medicaid changes, you're going to find those on your state pages. Looking forward to the VA and DoD information. This is, again, every area on the co-op is always changing because we're always posting announcements or pushing out new information. But the VA, our relationship with the VA is also changing, and we're working really closely to try to create better avenues of communication for you all and your practices, and also just at the national level to better understand the VA's policies. And as we know, they differ from VISN to VISN, so VISN or Veteran Integrated Service Networks, and they change pretty rapidly. Anytime a new solicitation comes out, things might change based on the new contracts that are issued. And while we can't really address contracting super specifically, we can talk about it in the broad sense. And so we're working with the VA, and we've been asked to ask you all as members to provide some feedback about your relationships with the VA. So we've got this survey posted here, and a cool thing about the co-op is this is embedded, so you don't have to go anywhere to take the survey. You literally can just type your information right here. You could just select your VISN where you operate, and you can file this. Say you have a great relationship or you have a terrible relationship, however you want to do it, and you can submit it right here. And you can submit it anonymously. And or you can provide your information so that we can reach back out to you. Either way you want to do it is fine with us. We've been asked to collect this data, and we're going to continue to collect that for the VA. So please don't hesitate to pop on and fill that survey out. And you may see other surveys like this throughout the co-op because it's a great way for us to collect information from you all. We do that general thing where we kind of define the program here. So you'll see TRICARE's defined, and the VA is defined, and the amputee care system here is defined, and what that looks like, what that means, how that operates, and the policies are all linked there as well. We've got some VA updates that we provide on a regular basis. So just trying to keep on top of the VA information that you all need. See here we have VA and O&P. A VA O&P here. So this is going to be the VA's policy on O&P. It's going to be all spelled out here on this page. So there's a final rule on prosthetics that was recently published. So we've got a little recap of that final rule. And then we've got an overview of the rehabilitation and prosthetic services part of the VA. And then we've got a page that's dedicated to each of the VISNs. So if you go onto the VISNs page and say you are in VISN 22, then you'll see that this has information about the administrative offices, where the VISN 22 actually operates, each of those healthcare systems. And the cases where there's prosthetics and sensory aid services, you can get direct phone numbers and extensions to those specific service areas, prosthetic service clinics, So good information. Anything that we could find that we thought might help you in practice, we've added here to the co-op. All right, so moving along, I think I referenced earlier, there's some VA coding stuff here. There's the definitions, VA DoD definitions. Again, these are going to be different than those that you see in the Medicare program, so important to kind of take a look and better familiarize yourself with the VA and DoD definitions. And we do cover some we call this public interest areas. This isn't necessarily policy, but EACE, so the Extremity Trauma and Amputation Centers of Excellence, this is a program within the DoD and VA partnership that is actually really important in setting standards and setting practice. So we reference this quite a bit because it's good for us to just know where are these ideas coming from that you see implemented in the VA, and this is just a little information about that. So occasionally you'll find some sections throughout the co-op that just have information about a center within the government that's operating and providing information about things that are relevant for your patient populations, and that's what this is in this case. So moving on to the commercial payer section. We cover the big ones, and occasionally we'll do some research on a new one. So we found out about Centene recently, and it's not that, I shouldn't say we found out about them, but we were made aware that Centene was expanding its operation and that it was operating in a couple of different areas than we knew about. And so we went ahead and pulled Centene in as one of the top tier, you know, one that we're tracking on a regular basis. And then we pulled its policy up. So we were able to get access to the policy. So this is important, because now you don't have to go Google for this, right? Like, we've added the most recent policy we can find, and we'll continue to add those policies as often as we're made aware of them. So whether they come through a system that we use to track, or whether one of our members lets us know, hey, Centene's got a new policy, we'll pop in those policies as we find them, as we have them, and we will check to make sure that they're relevant. And again, you can always see its published date, so we won't ever post anything. Well, I shouldn't say we won't. When we post something, it date stamps it. So you can look and say, okay, this is a little dated. Maybe I should pop a note in and say, hey, Ashley, is there an update to this? Let me show you how to do that, actually. So say you want, and we're going to go back to the Centene pages. So say you're a little concerned that this is dated. You can highlight this here and comment directly on the line. So you can say comment, and so I'm gonna get this email, and it's gonna seem like the students are asking me about this, but I will say, is this policy current? And you can, oops, sorry about that. And you can save, is this policy current? And now that shows up here on the page. So it's a great way to just flag something for us at AOPA to say, hey, I noticed that this is from January of 2021. Is this still current? It is current, but I wanted to use this example to illustrate how you can communicate with us and how you can ask us these questions right in the moment. You don't have to send us an email or reach out separately. You can just ask right there on the page. And you can also submit a comment here if you're just want to ask a quick question, or share a challenge that you're experiencing. We've been working with Centene, and they're not covering something. You can share that information right here with us so that we can look into it for you. Again, we aren't submitting claims, and we're not delivering devices here at AOPA. So we really need you all to provide information about what you're experiencing so that we can work on policies that are going to make effective changes. All right, so moving away from the commercial payer section and into the research and quality page, this whole section on research and quality is designed to give you some meat on the bones when you've got to prove that there's a reason that you want to do what you want to do for your patients. So we're working on figuring out how to best create white papers and quick downloads that you can provide to physicians. Maybe you want to incorporate that in some of your marketing or marketing practices. So say you go in and do an in-service somewhere, take one of these studies with you. Take one of the research papers that we post here, or if you're interested in just looking at some of the more recent research, you can pop on here, and we do these investigator articles, principal investigator articles, so you can see the work from some of your colleagues in the profession and work that they're doing. So it's a great resource. We found that some of our members are utilizing these also for just team trainings and lunch and learns and just some general activities, staff activities in their facilities. So we welcome comments about ways that this can be more user-friendly for you, this content, and things that we can add, things that you're interested in seeing that might help you. But think about research and quality, the section on the co-op, as a tool for you to use to substantiate your reasoning. Maybe we're working with a insurance company, or you've got a call set with one of the medical directors at an insurance company about an appeal you've got in. Maybe you can find something on this section of the co-op to help with your claim. example of that would be if you're trying to get one of your patients a microprocessor knee, you could use the RAND results here from the key findings of the RAND study in your conversation with that medical director. The compliance section. So earlier at the beginning of the tutorial, I talked about the compliance guide that we have, which is a resource that is available for purchase through our bookstore. But we do have general compliance information. So this isn't going to help you. I mean, it can help you build a compliance plan, but it's not going to help you build the actual book that you keep, the resource book that you keep, or the templates. This doesn't have those templates, but it does have a lot of information about compliance and working with the government and all of the different entities that oversee the laws that govern you as a care provider. So a lot of that information is going to be here on the compliance page. So we go through laws and regulations. We talk about things like anti-kickback regulations and the fees and the fines that are associated with violations of those regulations. We've got HIPAA sections, we got Stark Law section, just anything that you might need to know if you think something doesn't feel right about this relationship that I've noticed with this hospital and this other provider or something like that. You can look that up. You can look information about why that would be allowed or not here in the compliance section. And you, more importantly, you can make sure that you're staying compliant by reviewing this section for your company. I mentioned earlier that State Matters page. This is, again, a pretty incredible resource. I have been really proud to work as a state rep. Prior to joining the staff at AOPA, I was a representative for North Carolina for AOPA's state rep, so little rep, not big rep like Congress, but you know, represented the O&P facilities in the state of North Carolina and kept up with policies and challenges that were facing the practitioners there in the state. And that is the same work that all of the AOPA state reps do in their states specifically. So this area, you know, we've got some really active states right now. Illinois is a very active state. They always have updates that are being posted to their page. They've got an active society there, ISOP, under the leadership of Jim Kaiser. And so it's just some great information there. Another really active state right now, and I know that we've got some folks on from the state, is New York. New York's even got a call to action out on their page right now, and several different pieces of legislation that were in the current session, which I think is actually coming to an end very soon. But I think it rolls over. They have two-year terms for their bills, I believe. But anyway, so we've got a lot of information about what's going on in New York there. So it's just a great resource for you and your state. And I encourage you to hop on and engage. You can always, again, leave your comments down here or provide any feedback that you'd like about what's going on in your state. We do separate those down into some maps just to remind you what jurisdiction you're in, or you know, tell your staff, help your staff understand what jurisdiction you're in for Medicare. And we've got some benchmarking and some different licensure information. So the benchmark plans here, we've got them all listed. This is what your state is required to cover under the Affordable Care Act. So you can find your state. These are also linked on the individual state pages, but just for brevity, we went ahead and did a benchmark plans page as well. A couple of good, we call these good practices. This is just some fun information that we wanted to provide the profession with. We cover charitable organizations, and our charitable organization page is dedicated to organizations that we have official relationships, so they're AOPA verified. These are organizations that we know the leadership teams that are part of these organizations. We have interacted with them and are tracking them on a regular basis and keep communication open with them. So these just are organizations that might be helpful for if you have a patient that is having trouble getting something paid for or having trouble getting access to a certain type of prostheses. These are great resources for you all to have. Or if you're interested in getting involved with outreach activities in the charitable organization realm, this is a good place to find out information about how to get involved. We have a member-to-member section. So if you are an AOPA member and you have created a tool that is free for the whole profession, or if you have a blog or a video series or just something that you want to share with the entire membership, as long as it's not fee-based, as long as it's free for public consumption, you can post that here on the member to member page with your logo. So it's also just a great way to get your logo out there and get your name out there. And we encourage you to do it. It's just going to be listed in alphabetical order here on the member to member page. And so we really appreciate anything you want to send our way. We did log a lot of member specific COVID responses. So we did this member generated COVID resource page also. And what we found is that people were willing, companies, AOPA members, were willing to actually share confidential information with us and you all and the whole profession, just, you know, for the good of the profession. And so we've got some of those policies and procedures here. You'll see confidential on the top, but we were given permission to share these from the leadership at those companies. Another good practices section we have a section for the students. This is sort of funny because I'm using their account right now to do the tutorial, but we've got a spinal case resource video. So the students at UW had to do a project on coding. They had to see a patient and then code a spinal brace delivery and then talk about how to submit that claim. And they had to do one for Medicare, I think, and one for a private payer. And so I had the opportunity to do a tutorial video. So what I'm doing for you all today, but on specifically this assignment that they had in school. It was just a really fun activity for us all to do. And anyway, so we created this video, but you might see some different student resources here. The reason I'm telling you is if you have interns or students in your office, get them on here. They will be so much more valuable to you all, to the profession as a whole, if they have access to all of this information early in their careers, because that the more information that they are able to store in their brains as they begin their career, the better off that they'll maintain that information throughout their careers. So please encourage your students or your residents or your interns to hop on to the co-op. The last section I'm going to cover, and I'm coming right up on the last end of the very end of this tutorial today, is our policy and coverage concerns. This is the newest section on the co-op, and again, here's one of those polls down here. What is the challenge that's facing the most challenging thing your company is facing? What do you want AOPA to look into right now? And as we get a few of these in, we start to post information about those. So the vacuum non-coverage was our first. We published it a while back, and we actually did a deep dive on 5781, L5781 coverage, and we did this PDF. So I'm going to share this with you because this is the type of research that we're doing on the AOPA side to see how we can increase access for your patients to certain types of devices and coverage for you all as companies. These are all the non-coverage statements, and we actually compared the way that these were written. So in some cases it would just say flat out not covered, but in other cases you could see things like do not meet the definition of medical necessity as published literature is insufficient. We know that's not true. So we were able to respond to Blue Cross Blue Shield Florida with a letter saying, that's not accurate. There is plenty of published literature sufficiently showing that vacuum assisted socket systems are beneficial for patients. And we would like you to reverse this policy. They have not reversed that policy yet, neither has United Healthcare. But what we found, so I'll pop out of this here and show you what we actually ended up finding, and you'll see here down in the comment section, is all of these people saying, hey, when we appealed this, when we went through the appeals process, they actually overturned it. UHC overturned this vacuum denial, gave us a favorable decision because they know that it should be that their patients should have access to this. Now that's happening a lot more often for Medicare Advantage programs, and it actually, because Medicare covers it, Medicare Advantage programs are required to cover it by law. So we're continuing to work on that. We did actually do a visual breakdown of the reimbursement, the published reimbursements on it. It's just a way to look at how things are being covered across the country, which is just a good perspective when you're trying to fight for reimbursement and coverage of a certain type of device. So we're actively doing one for cranial and for microprocessor controlled feet at the moment, foot ankle systems at the moment, but we're going to continue to build this out. This is absolutely an area of the co-op that we expect to grow over the coming months. All right, so I made it through all of that. That is the end of this tutorial. I'm so happy that you all could join me today. Thank you for taking the time to walk through this with us, and I hope this is a valuable tool for you all in practice. And let me know if you have any questions. I'm going to stick around for a couple more minutes. Happy to unmute your lines. Happy to have a conversation if you've got time and you feel like you want to ask any questions. Please don't hesitate. Again, this is being recorded, so you can share this with your staff or anyone else. And we encourage you to look for future tutorials so that they can get trained and utilize this resource as well. And I'm going to stick around, so let me know if you have questions. I'm not seeing any. All right. No one has their hands raised, so I'm not going to unmute any lines, but I appreciate you joining today, and we will keep you informed about next opportunities for co-op tutorial. All right, thanks everyone. Have a great day. Bye-bye.